Okay, let's talk about some vaccine principles. So the most important thing you need to remember about vaccines is never give them to an unhealthy animal. You always want to make sure that the animal is healthy. Okay? If an animal is sick, if they have a fever, that fever can kill the vaccine. It isn't stable to high heats. Okay? And when they're ill, their immune system is already busy. It's already trying to figure out what to do with the illness that they have. So better to just wait to vaccinate if they're ill. And you need to remember that vaccines take time. Just because I give a vaccine to an animal today doesn't mean 3 days from now they aren't going to come up with the disease. It takes time for the immune system to respond to the vaccine. Usually about 2 to 3 weeks. So this is important to tell your clients, and this is especially important for clients who want to board their animals. If they come in and say, I'm boarding my dog tomorrow because it has, and I need a Bordetella vaccine, that Bordetella vaccine really isn't going to protect them from Bordetella if they are exposed to it at the boarding facility. The third principle is that vaccines should be tailored. There is not a one-size-fits-all method when it comes to vaccines. They should be tailored to the animal and to the needs that they have. An indoor cat probably only needs the core vaccines of rabies and distemper. An outdoor cat might need some other vaccines, like the feline leukemia vaccine. They may need the FIV vaccine. You need to tailor it for the patient. The fourth thing to remember is that vaccines can have side effects. The thing with side effects is usually the first time they don't have one, the second time they get a vaccine, they may have mounted an immune response. They could develop hives. They can get anaphylactic shock. They could be sore. Probably the biggest thing to tell owners, though, is that they can be tired. They may go home and be a little sleepy. That's perfectly normal. Vomiting and diarrhea, not as much, though it can happen sometimes. The fifth thing to remember to tell clients is that most vaccines need boosters. You need to booster them a series of 3 shots, especially for like distemper, Lyme's, Bordetella. Then they need to be boosted after that. Depending on your clinic and what your clinic protocol is how often they're boosted after their first series. The second is timing is most important. We talked in a few videos ago about maternal antibodies, so the timing is important. You want to make sure that you get those vaccines to them when the maternal response is lowered. If you're going to use a vaccine to prevent brucellosis, you want to give that before you take the animal to be bred. So think about the timing. Again, this would be your Bordetella. If you're going to board your animal, 1 month before you board it is when you want to get the vaccine for Bordetella, not the day of. The seventh thing to remember is proper handling. You need to make sure that they're refrigerated as soon as they come into the clinic. You don't want to recombine them until right before you give the vaccine. They shouldn't be stored in the syringes long term. You want to pretty much mix them, take them out of the fridge, mix them, and give them within about a 20-minute period. And the final thing to remember, and this is very important, no vaccine is 100%. I cannot give a vaccine and guarantee that 100% of the time an animal will not get the disease. It all kind of goes down to, was the animal sick at the time? Was the animal's immune system busy at the time? Did we have the right amount of time? Okay, did we give the right amount of immune response time? Did they get their boosters? If they don't get their boosters, we can't say that vaccine is 100%. And then we go back to timing again. Timing is everything when it comes to vaccines. So the most important thing you need to make sure your clients know is that a vaccine is not 100% effective. There is always a slight risk. So after we've discussed these things with the clients, we need to talk about how we're going to administer them. And in dogs and cats, the most common way that we administer vaccines is sub-Q. Some vaccines are given IM, but pretty much most of them are sub-Q. These are the most common ways that we can get a systemic response, which is why we do it sub-Q or IM. Intranasal, this tends to be Bordetella, and this provides a local effect, so we're localizing it in the upper respiratory system. There is a new feline leukemia vaccine out in the market. It's transdermal. This has a depot system to help to cause the immune system to respond. Aerosolizing animal vaccination. This is how they do large groups like poultry barns, and this is Newcastle is an example of that. PO. Generally, they put it in the food or in the water that the animals get. Swines, they tend to vaccinate swines like this, but they also tend to vaccinate wildlife like raccoons and skunks for rabies by using PO. Okay. And then you can vaccinate fish in the water. So you would put the vaccine in the water, and the fish would then get it into their system through various means. So, have a great day. Bye.